My name's Paul Rink. I'm from the UK. You can probably tell that by my accent. Although it's you guys who've got the accent, we don't. And I live just north of Manchester in the UK. And my story began really in the early part of 2006. At that time, I didn't know what the prostate was. I didn't know where it was. I didn't know what it was. I didn't know what it did. But it must have been okay because it wasn't giving me any trouble. And the way it started was that I had to start going to the bathroom a little bit more often. And I thought, well, that was just, old age and nothing to really bother about. No other symptoms. And I think that's one of the problems with prostate cancer, that there aren't any obvious symptoms. So I went to see a specialist. He didn't think there was anything to worry about. He did an internal examination, said, well, you probably ought to have a biopsy, but there's only a 25% chance that there's a problem. So we really didn't worry too much about it. And we went for the biopsy, and I still remember the date, the 6th of July, 2006. The doctor called us in, the specialist called us in, said you've got prostate cancer, and that's not the easy part that I have to tell you. You've got a Gleason 9, which didn't mean anything to me, so he then went through the 1 to 10 and the aggressiveness of the Gleason. And you've got I think it was a T3A prostate cancer. He was a surgeon. He said, I can't deal with this. It's too acute for me to deal with. So I said, well, what do I do? And he said, well, you could go and see a specialist at the major cancer hospital. We have a very famous cancer hospital in Manchester. So we arranged that I go and see this specialist in Manchester at the cancer hospital. And that's another date which will be forever printed on my mind, 17th of July. We didn't think there was any big deal. In fact, I actually went on my own. Marley and I always go to these things together, but I went on my own. Sat down with this guy, and he said, Mr. Rink, you've got a very aggressive cancer, a Gleason 9. Basically, I can't do anything for you. And I said, well, hang about, there must be some treatment. He said, we might try some hormone treatment, but really there's nothing that can be done. I said, well, how long is this going to take? He said, well, you're going to live for 9 or 12 months, and that's it. And I was in and out in 10 minutes. And that was, to put it mildly, a pretty considerable shock to the system. I can still remember driving back on the highway back home, feeling really angry that all these people going down the other way on the highway were going to be all right, they're fine, they're around in a year, and I'm going to be dead. So we decided to go on the internet. And this is really the power of the internet. And we gave up on the UK, and we found a hospital, I think it was in Atlanta, and this one. And we read up on it. And I have to say, if I had any advice for anybody who is told they have prostate cancer, is take control of it yourself and really learn about it and understand it. And, within a few weeks, both Marlene and I knew a lot about prostate cancer, what it was and how it affected the body and everything else. And we rang up Atlanta and we rang up Dattoli. And I don't want this to sound like a commercial, but the friendliness and the ability to talk and the empathy from this clinic was very, very different to the other one we tried. The other thing that happened at the same time, which was purely by coincidence, is that a close friend of ours rang us, because everyone, of course, knew that I got prostate cancer. News travels fast with something like that. And she rang and said, you know, I know somebody who knows somebody who's been to a clinic in America to be treated for prostate cancer. Why don't you talk to them? And at that time, it's all about trying to gather information and all the rest of it. So we said, yeah, great, right, we'll talk to them. So we rang John and Barbara, and we didn't know them from Adam. And guess what? He'd been to Dattoli. And he had a Gleason 8, and he'd been told as well by doctors in the UK that they couldn't help him. And he was a year down the track. We went round for dinner, and if you ever wanted a sort of a PR program for the Dattoli clinic, you just set John and Barbara going, and they're off. So that gave us both a huge amount of confidence. So we decided, okay, we're going to go to the Dattoli clinic. So we rang again and had one of these, what do you call them, sessions with Dr. Suresh. It's a phone consultation. Fantastic. I mean, he was on the phone for an hour and a quarter. Thought to myself, hang about, you know, this is costing a lot of his time, and he doesn't even know that I'm coming, but he's prepared to do that, which was, you know, really impressed us. And he said, well, you know, I can't tell you anything at the moment, but send all the stuff over, send all your diagnostics over, and we'll take a look at it. So we did that. They rang back and said, come over, we think we can do something. The impression we were given by the doctors and by the Beamers meetings as well, which I'll come on to in a minute, that we probably had an 80-85% chance of success here. Well, that's a pretty good rating against a 0% that I've been given in the UK. We went through the 25 sessions. We came to the Beamers evenings, met a lot of other people, because there's a lot in this about mutual support. You're going through a really difficult time. So to have other people around who are going through the same thing gives you a tremendous amount of good feeling. And in my first week, I was here, and I was having the treatment, and Marlene was upset. And there was a lady next to her. She said, are you all right, dear? And Marlene said, no, I'm not. And those people have become firm friends. And every time we come over, we see them 2 or 3 times. They live down in Venice. The staff were delightful. I mean, you know, they're dealing with patients who are dealing with something that could kill them. And here we are 2.5 years after the treatment is finished. I've just had my examination. They can't find any trace of cancer cells. It's incredible when you have that ultrasound. And when I first had it, the whole prostate was a mass of red dots. And I have the ultrasound now, and it's just grey. And my PSA is 0.014. And I feel I've got my energy back. I feel as healthy as I ever did. And you know, what these people have done is a miracle.